there's one or two apologies I've received from Ida Skoulos and Anne Canning. I haven't received any more, and Alex, you updated me just a few minutes ago, so I assume that's all we have. And we have one introduction. I'd like Helen Woodland. Do you want to just introduce yourself, because this is your first meeting?
Thanks, Mark. Yeah, Helen Woodland. I am the new group director for Adult Social Care, Health and Integration for Hackney Council.
Great, welcome, Helen. So just in terms of going through the declarations of interest, does anybody want to bring anything to our attention in terms of anything on the agenda? Otherwise, we should note them. And then I'm going to just go to the minutes straight away as well for efficiency. Any comments on the minutes? Anything anyone wants to bring up? No. Okay. So can I ask the City ICB to note both the declarations and the minutes, please, and Hackney ICB similarly? A few nods would be good.
Agreed.
Thank you very much. Thank you. They haven't got any questions from the public for this section of the meeting, so I'm going to go straight through to ask Siobhan to start to talk us through the vaccination update.
Thanks, Mark. Good morning, everybody. So I apologise for the late circulation of the papers for you today, but they basically are sort of hot off the press. So we had looked at these yesterday afternoon in our vaccination steering group. So that's part of the data just is very live all of the time. So really today I'm going to focus on a couple of key issues really. So if you look at the third page, fourth, vaccination of high priority cohorts. So that's where each cohort is in the table and the percentages there. You'll see that there's a range of percentages across the 9 cohorts which we're working on at the moment. So that's basically everybody over 50. And we have a variety of numbers there, from at the top end at 90%, which is our care home data, right down to 61% around the 50 to 54s. And obviously that's partly due to the time that the cohorts have been open to the vaccination programme. But you'll see in the grey column, the week on week change, that whilst we are still actively running the programme and vaccinating and filling slots, the week on week progress is slowing now quite considerably, as in the uptake by week is smaller. And then you'll see the decline column, and then right over on the far hand side is the residual column. So really from my perspective, and I think from a partnership and health protection perspective, that's the group now that we are really looking to focus on, especially during April, whilst there is limited vaccine supply, but also first doses for any new cohorts are not coming online yet. So it's second doses plus really trying to catch up with those residual populations that have not yet taken up the vaccination. So, the good news is obviously that we are delivering the programme, but the concerning news is this residual population, and it is meaning that our activity numbers reflect quite low across, certainly within London, and certainly from a national perspective, London is actually much lower than lots of other parts of the country. And bearing in mind, the kind of national aim and expectation of a kind of 90–95% uptake for vaccination, you can see that we have some way to go in order to deliver on that target. Whether that's realistic or not is debatable, I guess, but that's the reality that we're in. And in terms of population health and limiting the harm from COVID and further possibility of people dying and things being very difficult for hospital care, that's why it's so important really that we try to really push hard on these numbers. So the next time you see this data, we'll probably, what we're going to reframe how we present it a little bit, so we can look at a sense of trajectory, you know, from like where we are now and what we need, how many more people we need to deliver the vaccination to in order to start seeing progress against that 95% objective, rather than looking at a week-on-week change, because we're just thinking that might be a more useful way for us to kind of think about what we need to achieve and how we need to phase what we're doing. And then I guess really to move on to the engagement piece. So there's some ethnicity data in your pack as well, which is helpfully presents uptake versus ethnicity groups. And then what we are trying to do is then, off the back of that data and that intelligence and that geography in terms of looking at things from a PCN perspective, is undertake our engagement piece, which is detailed in the final slide. So we have secured some additional resources from NHS England to help with our kind of inequalities and engagement piece of around £150,000, and the list of activities is there that we are working on. I think this really is the big piece for us as a partnership, really, is how we kind of work collectively around some of this messaging and some of this providing access and opportunity for people to have the vaccination, following a kind of an active, engaged conversation with people that from their own community, or from people from organisations and institutions that people trust, and that includes GPs, obviously, but it may also include lots of other people in our community. So that's where we're focusing, really, to try to address some of that that concern about residual numbers. And I know there are a lot of people on this call who are actively involved in some of those discussions, not least of all our public health colleagues, who are really getting behind us on helping to address some of these concerning inequalities, which, you know, we don't want to compound again by a further possibility of an impact from, you know, another wave of COVID now that the restrictions are being lifted a bit. So I'll pause there, and I'll hand back to you, Mark, to handle direct any questions to me.
Great, thanks very much. I'm sorry, I should have said it right at the top end. Of course, as is our habit now, we are recorded, and this will be posted subsequent after the meeting, as recent meetings have been, just to remind participants. So I've got a few hands up. I think, Chris, you're first, and then I'll go through the hands according to the list in front of me. So, Chris.
Thank you very much, and thanks, Siobhan, and to everyone who I know is working very hard on this. I just wanted a bit more info, if you've got it, about the declined. So when we mark someone as declined, does that mean they've had a conversation with their GP or a medical professional who they trust, who's actually talked them through before marking them as declined? I mean, how much? I just want a bit more detail about what defines declined, and also that 8% overall declined figure. How does that compare nationally? Thank you.
Thanks, Chris. So I'll have to get back to you on the second question, actually, around the decline rate, because I don't know that off the top of my head. But in terms of what process is followed, so all people invited for vaccination have a conversation, or have certainly have a minimum of 3 contacts from their practice, so before they would be coded as declined. So we also have a code for deferred. So there are some people who want to defer, who want to wait. And obviously that's an important message as well, that if people now are thinking, oh, I might want to take my first dose, they can come back in and have that. But at the moment, you would have to have been contacted 3 times and then to be coded as declined. And the actual templates that are in the GP record require that process to be followed and logged, that somebody's been contacted 3 times by the practice before they're coded as a decline.
Can I just add in regarding your second question, Chris? And I know some people registered people having been declined after even more contacts than that, because they reluctant to register them as declined. But nonetheless, the figures I saw yesterday, which were figures from I think only a few days ago, showed that for example, our cohort 2 patients aged 80 or over, decline rate 12%. In Havering, it was something like 2.47 or 2.5, I guess, % decline rate in that cohort comparatively. And across North East London, the other 5 CCG areas were somewhere in between, but we were the only ones in double figures. So, thank you. Randall.
Thank you. I suppose this is a version of a question that I've asked before, but how confident are we in the size of cohort? In other words, have we sort of matched this up against GP registrations? I appreciate there are some unregistered people as well, and we must have some estimate of the unregistered population. But I'm just trying to understand how confident we are in the statistics overall.
So the data that you're seeing today is from our clinical effectiveness group data, which is GP record data. So this is as good as it gets, really, from a GP registered perspective for City and Hackney.
So the size of cohort is, so in other words, this is the, if you will, the registered cohort.
Yeah.
So the unregistered would be people on top of that then.
Yes. And then the thing is that these are the people who have been vaccinated by our program as well. So in the NIMS data, which is the North East London data, that's the resident population. So wherever you've been vaccinated, because some people obviously are not being vaccinated in their local program. They might have had it done through work or
the national.
Yeah. So this is about what's happening locally.
And we don't really have a very clear view, I guess, on the lag. In other words,
it's only a couple of days, I think, even 24 hours. So to be fair, like even people who are vaccinated at the mass vaccination sites, it goes into the Pinnacle data, which feeds the EMIS record. So it all comes in eventually to the GP registered data.
Okay. And then, so when we go back through for this door knocking exercise that we're going to embark upon, we have a fairly certain set of people that we're trying to reach.
Yes, that would be really people who are complete non-responders, people that we just haven't been able to get hold of.
Okay, thank you.
Thanks, Randall. Just going through the list. Haren Patel? Haren? You've suddenly gone off camera. Oh, you're coming back.
Yeah, there. Thank you, Mark. So, Siobhan, I want to make 4 points. The first one is when they, to add to what you say, when they defer, the code is, though it is deferred, it comes as a decline. So that way the number builds up, even if they are not sure. So once you do defer, there is still a decline. So, but then they have a right to change their minds with whatever they have done, and declined or defer, so on. So that's one issue. The other issue which the GPs have come across, and I think I don't know what you can do about it or take it further to the NEL level, that where the vaccinations are done by other providers, like some people do for their own employees, and if they are a big employer, they source from somewhere, they are not coded properly on the Pinnacle. So it doesn't come to GPs as it should be. Normally, that's the process. Like in my practice, I've got 10 or 12 people who have been given 3-4 weeks ago, and it doesn't show on the system because it hasn't been coded properly on a Pinnacle. So I think that's an issue someone needs to pick up. The other one issue I'm asking you is, what is the kind of a status of supply over next 3 to 4 weeks, both Pfizer and AstraZeneca both, because that's another issue we would like to have a clarity on to make, reach the targets. And finally, you are going to bring some data on pharmacy
I'll let you come back on those ones, Sean, and then I'm going to actually gather some of the comments up collectively because of time. So go for those because there are quite a lot of points there.
Yes, okay. So we are aware that there is a bit of a coding, it's a bit of an issue in terms of how practices are applying some of the codes around deferred and decline. So we have got a piece of work going on at the moment where we're going to issue a protocol to practices so that they can be very clear that they are doing it in quite the right way, because there is a bit of a glitch there. So we don't anticipate that it's vast numbers of people that are being added into the decline box, actually, but until we've gone through all the practices via the PCN directors to be clear about how practices need to do it properly, we can't 100% be sure about the volumes of that, but I don't think it's significant or material because we discussed that yesterday with Gopal and Vinay as CDs. The Pinnacle codes about other places, I'll have to pick that up with North East London. I'm not familiar with what you're talking about, but I can certainly raise it. Supply. So supply is limited for the next month for sure, and obviously you will have all seen the AZ issues that emerged yesterday. None of which is terribly helpful from a encouragement point of view, because that requires a lot more discussion with people individually about the potential level of risk. But there was a webinar last night where that has been consolidated into ways in which clinicians can talk with patients about that. And there is obviously quite a likelihood that there'll be I think it's Moderna that may be offered to under 30s from May time. But we have got restricted supply of AZ and some Pfizer as well over the coming weeks, and we've had to refresh our plans yesterday around a reduced supply. So it literally can change day by day from a supply, because obviously it's a push model, and it's very hard to plan fully because you can get very little notice, and then you need to reframe your plans because the supply has changed. And that was yesterday's update, was that we needed to reframe some of our plans for the coming week in the view of limited AZ in particular, I believe.
Okay.
Thanks. I think
Pharmacy,
yeah. So yes, they're coming on stream now. Our pharmacists are able to offer circa 250-300 appointments a day in their pharmacy sites. They are we're certainly including them in the kind of the local offer, and but I do think that they are being impacted a bit by supply as well for the coming months. But we are also in discussions with them around some of the opportunities around possible outreach or supporting some of the more direct work with communities and engagement perspective as well. So they're definitely part of the footprint locally. Okay,
we'll move us on because Jake Ferguson. And I'll take the comments from Jake, Philip Glanville and Antoinette Bramble together, if that's okay, and then leave you to make notes, Sharon, and come back to the lot. Jake.
Thanks, Mark. For those that don't know, we're working with the voluntary sector and public health to echo messages and to try to normalise vaccine taking in as many communities as possible. I think, we have a monthly meeting where all the people that have had grant resources through public health come together, so we collect insight. I think there's a real request for there to be more honest information about the vaccine side effects, because we know that many people are holding on to see how others are impacted before perhaps taking the vaccine themselves. So the more information, reassurance we could give people that the side effects are temporary and so on. You'll have seen me in my newsletter with my shirt off getting jabbed, and I think we all need to do more of that. There is an increasing worry about a third wave, and I think people are looking for reassurance from the health system, public health, about what preparations are being made for that. More practically, there's some real success about mask wearing in community shops, and I think a meeting between shopkeepers agreed that mask wearing would be mandatory, and it's had a ripple effect into communities. People really enjoy getting free stuff, so the idea of people being given free masks was a good move, and if somehow that's linked to then also advice about, well, have you thought about taking the vaccine, blah, 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 blah. You've got a way of engaging people that's simple, straightforward. They feel like they're getting a gift. Mental health is still a big issue, obviously, but people are looking for fun things to do, both physical and mentally. Couple final points is people don't realise that testing is still relevant after vaccinations. So maybe that's a message we need to reinforce. And then my final 2 points are about, future vaccines, Moderna and the others. Do we need to be letting people know more about that? So for those that are waiting to choose and have that option, they know what's coming. And my final point is, you may not know this, Siobhan, but what's happening with our schools, and is there ways that school children could be given exercises around the vaccine to take home and work with their parents on? Anyway, stop there.
Jake, there was a lot there, and Sean, I don't expect you to respond to all those points, because in fact, Jake, there's lots of people on the vaccination steering group who coordinate all this across the city in Hackney on this call. So it's really helpful because they can hear all those really helpful comments and feedback. So I'm going to go to Philip Glanville.
Thanks, Mark. And just to praise all the efforts happening on the ground. I think, having volunteered at John Scott last weekend, it's an incredible team, and there were junior medical students that had volunteered elsewhere or been deployed elsewhere in the system in London, and they said that our centre there was the best that they'd worked in, and that's been a huge partnership effort. And given the mobilisation happened at the weekend as well, a huge credit to everyone on the call and the system. My couple of questions were, I know that it says targeted community engagement and outreach with Can and Swim, and it's a really excellent location, but I can't see any publicity from any of the organisations. And I'm just thinking, while there is value in testing concept, the best examples of that kind of community stuff I've seen elsewhere has had a clear public element, and giving that sense that even if you're not going on the 12th to the Pembrey, you're part of something. And I'm just a bit concerned, we're a couple of days out, and I know last time we did work with the Black community, we were we moved quite slowly on the comms and then had to kind of book up quite late. So just testing that really. And it's great that we've got the North London Mosque Muslim Centre involved pre-Ramadan, but just to reflect on the diversity of Hackney's Muslim communities, and making sure that then follows up, because we will get that challenge where people, it's not a jealousy, it's a you're working with them but you're not working with us challenge, and especially thinking about some of the larger mosques in the south of the borough. And then the final bit was just the bus, and whether there's a sort of missed opportunity to be vaccinating and doing information. So when you've got people engaged, and it seems like we're looking at doing info and targeting, but then still trying to get people through to other locations. Now I can see if you took the bus to Gilpin Square and you basically said, did you know the pharmacy over there can do you a vaccine right now, that you wouldn't bother doing vaccines on the bus because that would be pointless replication. If you were going somewhere that's more distant from geographical, you might want to do it at the same time. And obviously that's something that's part of the strategic data work that Siobhan was presenting. I just really welcome the level of detail, and that residual point I think is a really good one about what the exam question is, what we're targeting next. So thank you.
Okay, thanks for that. Antoinette Bramble.
Thank you. I'm just going to echo some of the points that the Mayor made, really, just to thank everyone for the work that they're doing. I volunteered at Bocking Street, and it was a really well-run facility, and people giving their time is just really appreciated. I did see quite a few people coming in from Black and ethnic minority communities, but I know there was a big drive around that, and I know Jake and his team and the council did a lot of work and members to try and promote that. So it'd be interesting to look at the data to see that over time, are we getting more people from diverse communities coming through? But reiterate what Jake said, it's a constant communication, constant give space and then give information, because I worry about what's happening around AstraZeneca, people worrying and not wanting to take it and not wanting some of the positive work that's gone on to be undone. So just remembering that constant work that we have to do with our community. The last thing I'll say quickly about schools is that Hackney Council teachers wrote some lessons on vaccinations for Key Stage 1 and Key Stage 2. We've done that on behalf of City Hall, and that's been used across London, just to respond to Jake's point about schools. Thank you.
Great. Thanks, Antoinette. I'm going to suggest that we probably have to limit hands now. I'm going to keep going down, and then we'll just take a kind of a wrap up from Siobhan, and I'll come to you, Sandra, at the end as well, because I think you probably want to pick up on one or two of the points as well. So, Andrew Carter.
Thank you. It's just a very quick one, Siobhan, and sorry if you covered it already. It's just to get that update where we are with our rough sleepers and the efforts we're making to target them, and are we getting any data through that helps show us what's happening around the rough sleepers?
Great, thank you. So, in fact, Sandra, over to you.
Actually, I think Siobhan can probably answer that specific question better than I.
Well, do you want to come in with other comments? I'll leave Siobhan to pick that one up.
Yeah, okay, thanks. I think really I was just wanted to respond to some of the points that Jake was making. I think that overall he makes a really good or gives a very good example, or a number of good examples of how important it is that we keep reiterating the messages. Excuse me. You can't expect to try to communicate something once and for everybody who needs to know it and hear it to have heard it and understood it and internalized it and acted upon it. And so communication about all of these things, whether it's about the importance of continuing with all of the other non-vaccination measures, including testing, but also the importance of continuing social distancing and, or I should say physical distancing, and face coverings and hand hygiene, as well as testing before as well as after vaccination, and how and ventilation and all of the measures that we've put in place before, how important that is. And we'll pick up on some of that when we discuss the refreshed local outbreak management plan. How we have to keep reiterating those messages, and how we have to keep making sure that when we've told people that they've understood it and that they're able to then promulgate that message. And that's clearly what we're trying to get our champions to do. And some of them are doing well, they're all doing a really good job. Some of them are actually doing that by specifically disseminating messages through WhatsApp groups, Facebook groups, etc. But we have to keep repeating the message, because if our specific group of voluntary and community organisations that are working with us, who've got our communications grants, are coming with feedback that they're not necessarily getting all of the all of the understanding, or that they're picking that up from members of the community that they're working with, that they're not getting all of the understanding. We have to do more, and so it's really kind of a call to action, really, that whenever any of us gets the opportunity, we have to keep repeating that, including about the side effects. From the beginning, we've been talking about side effects, that their side effects are normal and they're common, that many people, not necessarily most people, will get them, and have even talked about what they are. There's information about that on our websites, but we have to continue to have that conversation. So it's slightly disappointing to hear that people think we're not being honest about it or open about it. I think we have been, but clearly not, that message isn't getting through all of the time. And my blog from yesterday, I think it's going out today actually, specifically talks about the rare blood clots associated with the AstraZeneca vaccine and the new position of the recommendation from the Joint Committee on Vaccination and Immunisations and the excuse me, the MHRA position that the AstraZeneca vaccine should in preference only be offered to people over who are 30 and over, although it's not although it's safe for people of all ages, you know, in terms of the balance of risks, because that side effect is, or that potential side effect, because it's not been a demonstrated cause of it yet, is still very rare. And we've also been doing some work and putting some information out on comparing and contrasting the different vaccines. And I'm just wondering if there's something, and perhaps we'll have that conversation outside, that we can do that makes that information a bit easier to digest, so that our voluntary and community colleagues and champions can more easily have those conversations with people about what the different vaccines are, and help people to make a choice about whether they want to get the AstraZeneca one if they're under 30, because for the most part people still don't have a choice. When they go to the vaccination centre, there's still just whatever vaccine is available. And Councillor Bramble already picked up the point about schools.
Great, thank you, Sandra. Sorry, I missed a bit of that. I had suddenly the internet was cut off from my home for 20 seconds, which has started happening in the last few days, which is something I need to make some inquiries about. So apologies if I sort of disappear briefly and I reappear on my phone and I'm back on normal channels again. Siobhan, having had a few moments to gather your thoughts, any last?
Yes, so I mean, I would just completely echo what Sandra's just outlined, really, and I think that I suppose, as with most of the psychology almost of the whole experience of the pandemic, maybe there is something about us all learning to live with vaccination in the long term as well, and that we, because when we sort of started the programme in December, it was, you're very much living in the day-to-day and living in the immediate, but now we are starting to think about boosters in the autumn, and just it's like this vaccination is going to be part of our lives in response to COVID, like everything else in response to COVID. So we do really need to think about ongoing dialogue and communication with people, because this is not a quick fix on any level in whatever domain, really. And we have to, I think it's really important that we do that call to action, and that everybody kind of engages with what are really legitimate questions that we should be able to respond to, and I think that's really important. Just a couple of things then in terms of Phil's comments in particular around the publicity from CAN and SWIM. My understanding from yesterday is that both organisations are actively doing that publicity at the moment. They have already started making some bookings for the sessions. I'm very happy to ask that to be shared today, so we can be clear that it's getting out and about with people. Yes, I understood about the mosque, and the bus thing is, again, that's one of our sort of active projects, and we are really keen, as the Mayor says, to look at the opportunity of just not doing communication but doing vaccination where we can, from that perspective. And we are looking to talk to some of our clinical pharmacists around that in particular, whether they may be able to help us put together our own mobile vaccination team to help work alongside that. But we've also put ourselves forward to take part in a pilot with the LAS, who are also interested in being able to provide a mobile vaccination. So that might be something else that we can deploy. Just to say, we have a walk-in event as well on the 11th, which again, in terms of trying to open up access, and just so people, if you haven't booked, but you can just go along. And we're hoping that we may be able to do more of those sorts of events to just keep loosening up the potential barriers to access. And then finally, on the rough sleepers, Andrew, yes, we do keep data on uptake around that cohort, and we are in discussions with ELFT and the outreach team there about additional clinics or additional outreach vaccination with them. But the plan with the XL team is still there, but it's not quite for a couple of weeks yet. But we're hoping we can bring it forward with involvement from the ELF team. I think that's all I'll say, Mark. Great. Okay, thanks, Sandra. Siobhan, sorry, I'm just looking at reading Sandra's name in front of me. Sorry, and Chris, there's some information gone into the chat, which I think will be helpful in terms of further information for people to look at. Okay, so Deanna, can I turn to you as usual? Data intelligence. I'm slightly minded of the time because I know we've got the refreshed local outbreak management plan. Often that part of the agenda is we always shorten, but today we might want to have a little bit more time on that, and hopefully the numbers are encouraging enough. I don't wish to foreshorten what you have to say too much, but I'm just aware that we have to finish the meeting in about 15 minutes or so.
Yes. Oh, I'll be quick today.
Thank you.
Can you all see my screen, firstly?
Yeah, I've got it.
Yes. So I'll just go through the public dashboard to present what's happening on the ground in terms of cases and testing rates, deaths, etc. And then just flip a little bit to our secure dashboard just to supplement with some of the extra information. So in terms of the number of cases, it's quite encouraging that we keep seeing the decline in the number of cases. And in the City of London, for instance, the last week we saw 0 cases, which is great. We haven't seen 0 cases in the City of London since September last year. That is a welcome change. There was a slight increase in the number of weekly cases just a couple of weeks back, and that coincided with the wider opening. But again, this week, the numbers continue to decline, which is great. In London, overall, the rates and just the actual numbers of cases are also on the decline in most of the boroughs. And I think only about 3 boroughs have seen an increase in either the population under 65 or in the 65s. But again, the numbers are quite small, the absolute numbers. For instance, we had 47 cases in the last week in Hackney. In terms of how that's different by different age groups, so we did see a slight increase in the number of cases and the incidence rates in the youngest age group around mid-March, so around here. But now it has gone down again. So again, encouraging to see that, and probably not surprising that it has increased a little bit as people started socialize a little bit more than they were in the previous months. And in terms of how that looks geographically, so most of the wards now see incidence rates of under 25 per 100,000 population, so really low incidence rates, with an exception of some wards here in the north of the borough and some other wards where the incidence rate is still quite low, between 25 and 50. And the increases week on, if they do occur, it's usually single digits, makes the whole difference. So because the numbers are quite small, absolute numbers are quite small, as I already said in the beginning. In terms of how we compare with the other London areas, we're towards the bottom of the distribution. So our incidence rates are really low compared with some of the other boroughs. But again, this is the highest incidence rate in Bexley is under 50 per 100,000 population. And if you remember, in December and January, we were at around 1,000 per 100,000 population. So that is, again, it's quite low overall. And with testing, so we have seen some decline in the number of tests that have been taken week on. This particular chart presents just the PCR tests, but we do know that in Hackney, for example, if I filter into here, in Hackney, more tests are taken through the lateral flow route. And you can see it again, if I just filter into that, you can see that. So, but the rate of uptake has been declining, so that there were fewer tests this week than there was last week and the few weeks before. So while there's still quite a larger volume of tests, the number of tests taking every week is actually declining, which is something probably needing to be looking at why they're declining and maybe among whom. We do know that differently from, for example, the beginning of the pandemic, where some of our diverse communities did not readily take up testing. Now it's quite a different picture. So the highest testing rate is actually among the Black residents, and across all age groups, or maybe between 30 and 50, those have quite lower testing rates, but the uptake's actually quite good. But the decline is maybe worrying if it occurs in a certain population group. Again, we will have a look at that and see whether any insight comes up from the data that we've got and why it might be declining. Again, we might be seeing an increase in the coming weeks, given the Prime Minister's announcement, and we will also be looking at that to see whether the offer is being taken up by certain population groups and not others. So how will that differ in the future? We also do now host a vaccination map on the public side, so that shows the proportion vaccinated by MSOA, so which is a middle super output area. It doesn't mean anything to most people, so we have included a name there just so people know where they are. And that could be filtered by different demographics. This is public data that comes from the NHS website, so we have just publicized what comes from there, but we also have a secure dashboard that we use, which is this, and this is flipped. So instead of showing proportion vaccinated, this actually shows areas with a higher proportion of unvaccinated. So for instance, when we take the total population, so everybody age 15 or over, you can see that some areas do show a higher proportion of unvaccinated. And again, we can then filter into specific cohorts and see how the uptake differs for that particular, say this one is 80 plus by area. So all of this information is being presented at relevant strategic groups, and the decisions are being made based on that information. We're also working with Siobhan and Laura, the NHS colleagues, to get detailed data on people who have not yet been vaccinated, including those who have refused to be vaccinated or could not be contacted to be vaccinated, to see whether there are any pockets within our borough where more work could be done to encourage vaccination uptake. And then lastly is the deaths from COVID-19. So in the last week, we have not seen any deaths, which is very good news. And overall, we do see that our number of weekly deaths is way below the 5-year average that we would expect to see at this time of year, which is again good news. I will stop here and take questions if there are any.
Great, thanks, Diana. One question was from Jake's comment really about people being worried about third wave, and I suppose that in a way segues into our the management plan review and going forward, which I want us to have a bit of time to speak about. And I'm filling in a gap. No, I can't see new hands come up or other questions, Diana. So thank you very much. Obviously, it's all very encouraging what you've presented. So thank you for sharing that. And I'll pass straight to you, Sandra, to give us a bit of an update in terms of the local outbreak management plan and the new version of it. I know you've given us a detailed version and a more public-facing one. You want to tell us some of the highlights of that, and of course how that does relate to things like third wave management.
Thank you.
Etc.
Thank you, Mark. So you may remember that from last time I told you that we had to submit a draft to the Department of Health on the 12th of March, but we did continue working on it, and we now have a more developed and detailed update of what's now called a local outbreak management plan, which is in the pack. And I'm going to just take you through some of the key points in the more succinct sort of executive summary public facing document. And I'm just going to share this. Oh. Right. So I'm just going to start here with this to give you an indication of where we're focusing. So the requirement to update our plans, and as you know, we've been updating our plan periodically all the way through, but the requirement from the Department of Health and Social Care to update the plan recently was because of a number of things, including the transition from Public Health England to what's now become the UK Health Security Agency on the 1st of April, and to reflect the change in responsibilities, but also because over the past maybe 6 months, a number of things have arisen, including variants of, in fact, over the not just 6 months, there have been areas since the beginning, like Leicester, Blackburn with Darwin, where they've had ongoing transmission and had been almost in a state of permanent lockdown of one degree or another, more or less all the way through. And then in particular in the last 6 months, the new variants that had come up, which you'll see described in the document as variants of concern. So like the one that which is called P1, which was identified in Brazil, so you sometimes hear it called the Brazilian variant, and the B1.351, which was first identified in South Africa, so sometimes called the South African variant. And then, of course, we've got the B1.117, which was the one that was identified in Kent, which has now become the predominant one in the UK, taken over from the original virus because it was so much more transmissible and was what caused that big surge in infections that we had towards the end of last year and beginning of this year. So so understanding how variants are spreading, and in particular being able to respond to these variants, not just those particular ones, but any new variants that arise that are of particular concern, hence the moniker variants of concern, because they are especially transmissible or because they cause more severe disease or whatever it is that gives rise to that specific concern. So having something reflected in our plan that says we know that we are on the lookout for these. They have a national plan for that, which is about genome sequencing, etc. But what are we doing at local level so that we understand how to respond if one of these variants is identified in our area? What do we do about ongoing transmission or enduring transmission as it's described in the national plan? And although it wasn't on the same scale, clearly we had that outbreak that went on for many, many months. And so we've also had a bit of experience with that. Those were the two major things, but also to have our plan align with the national plan, including the roadmap, which is why I've started here. And so this is where we are at the moment and what we've done. So this was a reflection of a snapshot, if you like, of where we are when this plan is published in terms of the scale up of testing, which was the other thing actually that happened that needed to be reflected, was the implementation of community testing using the lateral flow devices and the availability of testing for people who don't have symptoms. So if we move on, this tells you what our priorities are in the plan now. They look quite similar to the priorities we had before, but the specifics of underneath those are slightly different. So the details are reflected here, including that around the outbreak management, we are going to be really clear about being able to understand when and if variants arise in our population, and that links to the data, because that's where we the data that we get back about tests and the test results is where we understand what's happening with that. And sorry, the one at the bottom that's hidden by the page number says resourcing. I don't know. I don't think I can get rid of that, I'm afraid. But it just says resourcing and making sure that that's one of our priorities, making sure that we've got the capacity to manage, that we've got the right amount of staff and the funding to support the activities, etc. We're spending much more of our energy on making sure that people have support for self-isolation and putting some wraparound support. Not forgetting, as we said earlier, that the non-vaccine measures are just as important in being able to get manage the pandemic as the vaccine itself. And so when people are infected, making sure that they self-isolate and that we have effective contact tracing continues to be really important for us. And focusing more on our local enhanced contact tracing system is also one of our key priorities. So I'm going to stop there because you have this in your packs and we've run out of time really, and just leave it for questions.
Okay, great. Thank you, Sandra. So Randall Anderson, you've got your hand up. Randall, over to you.
Yeah, it's really just a wording issue, I suppose, but 5.1 testing on page 16 rather implies that for residents, the information is on the Hackney website, and for businesses, it's on the city website. And I think that's certainly wrong. So I would hope that we could look at the wording there and reflect the actual reality.
I don't think that is wrong, but I will check. I think that the test booking is in one place, but I will make sure that the team checks that.
I mean, I suppose I mean, if you're a city resident and you go to the city website, there's obviously information on how to get a booking. It may, in fact, then go through to the Hackney site in some way, but it just sort of implies that the city residents have been forgotten about or something, which I think would be unfortunate.
Okay, well, that's not that's not what was intended to be implied. What was intended was to make sure that people had the most direct link to the place where they can book a test. But we can revise the wording if that's helpful.
Thank you.
Good. The other hand is actually yours, Sandra. So I'll ask just a quick question, is on the governance diagram in terms of the vaccination steering group, where public health and everybody who needs to be on it is on it. I couldn't see where that was on in terms of the governance there, just linking that up. I have no doubt that it is linked up, but I just couldn't see it on the sort of organogram chart. And my other point was I suppose about the resources. We know, I mean, we'll see from the finance papers later in the agenda that money has and your team's time and resources hugely expended in addition to the money that's come. And I just wondered whether how optimistic we were about getting some more financial resource, for example.
Yeah. So in terms of the governance chart, you're right. The vaccine steering group isn't on there, and that was just an oversight, and we will have to revise that. But and we'll have to think about whether there's any other groups. I don't think there are, but the vaccine steering group is definitely one. We have had some confirmation, so we're not getting any more specific test and trace funding, but we have been able to carry over any residual that we didn't spend within the 2021 financial year, and we do have a small amount left. We have been provided with some additional contained outbreak management fund money, and certainly it's been awarded on a month-by-month basis. And I'm trying to remember exactly what the letter said, whether it's guaranteed up till June. I think that's what it said. We've definitely got money for testing up until June for the the lateral flow testing. And whether I'm confusing the two letters and thinking that I've got the contained outbreak fund up until June, or just the testing money up until June, I'd have to check and get back to you. But the reason that our plan only goes up until the end of June is for two reasons. And one is that we don't have any guarantee on the funding beyond June, and we don't have any certainty about what the national plan is going to be beyond June. So we're trying to manage what we can within the resources.
Okay, great. Okay, that's a helpful update as well. Well, I don't see any other hands, so I think we should probably wrap up at that stage. Thank you very much for that, Sandra. We're nearly at 10 o'clock now, so what I propose is that we start the substantial meeting 5 minutes late, just to give us our promised brief break between the two meetings, a quick sort of 6 minutes rather than 10, and reconvene just before 5 past. So with that, I'll see you shortly. Thanks very much. Right. Morning, Anne. I know you. We got your apologies for missing the first bit. Right, let's switch around here.
Hi, Mark. Steve.
Hello, who's that?
Health Watch City of London.
Hello, Steve.
I'm going to have to leave after about 20 minutes. I have to get to Excel for my second jab this morning.
Right, good. Okay.
I hope it's a reasonable excuse.
I think it's a very good excuse. I hope everyone heard it. And congratulate you on getting it.
Thank you.
Good. I think I can see lots of people dropping back in again. Just on that agenda. So I'm going to propose we start. It's 5 minutes late, but as I don't propose to go around doing welcome introductions again, and apologies, we did that at the top of the meeting, but I know for one or two people who might have joined us from the public, just to remind us that it's a shortened agenda today because of guidance we've had around management with PERDA because of the London Mayor elections. So with that in mind, a slightly shorter agenda, and I shall aim to finish as near to 11:30 as we can. And just reminding everyone to be mindful that therefore discussion needs to be sort of kept as politically neutral as possible because of PERDA. We are recorded. This is, as now our custom, will be posted later. So everyone to know that. So I shall move on quickly to declarations of interest. Just to see if anybody has any comments they want to change to the register, or anything in relation to the agenda today. Steve, you've got your hand up. You're on mute though.
Sorry, a member of the Name and Practice and a trustee of the City of London Health Watch.
Okay, sure. So, and Sandra, you've got your hand up too.
I haven't got my hand up. I don't know why it's registering that for you, Mark. Sorry.
Okay. Okay.
I'll try putting it up and putting it down again and see if it turns off at your end. But
Fine. Well, if it doesn't, you'll have to wave your hand in the old-fashioned way to get my or interrupt me in some way. Anyway, okay, fine. So can I ask the City ICB members to note the declarations of interest? And similarly, Hackney ones too. Can you just wave and nod and shake? And thank you, thank you, thank you, everyone. Lovely, thanks. So we do have a question from the public, which came in advance from Shirley Islam. I'm not sure if Shirley's on the call. I think she said she was going to be, but she apparently asked if I could read it out. So City of London unpaid carers were historically able to use a few services by the Contracted Carer Support Organisation in Hackney. I was told at the time the CCG budget for some services were shared. Since Carers First took over the Hackney contract, City of London unpaid carers are not permitted to use any of the Carers First service. Is there a reason for this change? During the pandemic, some Carers First activities are being provided via Zoom and phone, which, as historically was, may be available to City unpaid carers as well. How can we find out what shared CCG services are available to us unpaid carers in the City? Now, I'm not sure, the question came yesterday, and so it was too late to be able to kind of really put together a thorough answer. I don't know if anyone on the call can contribute. If not, we'll obviously have to come back in writing to you, Shirley, and also put it as an addendum to the minutes at the meeting. Steve, you've got your hand up as well. Did you have something else to say about that?
Yes, this arose because a carer in the city had an out-of-hours need for urgent advice. And currently, as far as any carer can find out, the city only provides advice and backup Monday to Friday, 9 to 5. There is no out-of-hours backup that we carers could find. They used to be able to use the Hackney Carer Centre 24/7, but that seems to have stopped.
Right. Okay. Well, I think I can't see any hands come up from members, and I wouldn't expect it to, because they obviously this is quite a short notice question, and we'll have to get back to you in writing in the way I described, and similarly to you, Steve, copy you into the response to the Health Watch as well. So, I think.
Thank you.
Randall Anderson, you just popped your hand up. No, Randall, your hand's gone down again. Okay. All right.
Sorry. I was trying to do the right thing, take my hand down and unmute, and I managed to take it down and not unmute.
There you go. You're fine.
This raises, I think, an important sort of broader issue, which is, if the CCG is funding something, it should be available to all, CCG people, including city residents. And so it would seem quite strange indeed if we'd managed to fund something that was now only available to Hackney residents. So I would like some clarity on whether somehow that position has changed, or if this is just in some way, if in fact it is as described, an error.
Siobhan, do you want to come in?
I just really, well, I guess just to pick up what Randall's saying is that I completely agree. I think that this must be a communication glitch in some shape or form, because we would not say that if we were for using CCG resource, we wouldn't be excluding city residents. So I think something's got lost in translation, as I would imagine, and we just need to put it straight, pretty sharpish, I would imagine.
Yeah, I believe that's what happened. There was just miscommunication somewhere along the line, and it got wiped off the website somehow.
Yeah.
Okay. All right. Well, thank you, Steve. So we'll bring that back in more substantive written answer in the way I described anyway. But hopefully that will be fairly straightforward to sort of sort out. So let's go on into the minutes of the last meeting. Does anyone have any comments or corrections to make on them? Your hands up. I'll take them in the whole. Nope, I can't see any. Steve, you've still got your hand up. I assume that was just a legacy hand. Good. So can I ask that the Hackney ICB approve the minutes and the City ICB approve the minutes? Approved. Thank you very much. So moving on to the action tracker. Actually, I'll just take a matter arising off the minutes, if you indulge me for a second. Just to say on page 10.5.3, Honor mentioned that she was about to have an interview. I can just delighted to confirm that was successful. So Honor, along with Catherine McAdam and Anne Saunders, the three of them were all successfully appointed as associate layer members to the Integrated Care partnership. That was done last time since the last meeting, so that's good news. And they join our substantive lay member who is on the CCG board at NEL, Sue Evans, who will continue to do work in the City Hackney ICB as well. So just wanted to note sort of congratulations to them for getting those roles. They are essentially sort of related to transition, though. They are 1 year posts initially, but anyway, and then they'll be worked on like everything else is over the next year. So that was a quick matter arising. Anything on the action tracker? So there's a couple of them which have dates to be announced yet and agreed, sorry. And the third one down Matt Hobbiton has circulated that, so that should be closed, the information about risk for CYMPF. The first one, I think I'm not sure there has been an update on. Jake or Jonathan, I don't know if you have anything to say about that.
Yeah, I think Jake has taken that forward, haven't you, Jake?
Yes, Jonathan, and Chair, Sandra Husband, Director of Public Health, has agreed to be our system champion for the BCS enabler. So we are due to meet in a few weeks to discuss what that means.
Great. Okay, well, that's good to know. Thanks for that update,
Sandra.
Thank you, Sandra. Super. So that can be closed as well, and the other two we need to work on bringing forward with a date. So let's move on then to our first substantial item, which is the update on the ICPB terms of reference. Jonathan, back to you.
Thank you, Mark. So I sent out a short note. So as I think we've mentioned before, Brown Jacobson, a firm of lawyers, have been instructed by North East London CCG to develop the terms of reference for and all the governance for a North East London and at a system level. So they've been working with the three systems to develop terms of reference for the ICPB. We've been working with them for some time, and we've had feedback from a number of sources, but in particular we've had really helpful feedback from lawyers at the City of London and from Hackney. And I think, as I say in the note, there is this understandable tension between what we want to do in terms of having integrated governance and some of the rules and regulations that still apply in terms of how local authorities go about their business. So that's really been at the core of the changes that have been made. We've been making really good progress. There was a new draft came out late yesterday, which has been shared with the lawyers at the City and at London Borough of Hackney. And so we're pretty confident that we will have all of that resolved in the next week or so. At the same time, the Neighbourhood Health and Care Board partners have looked at some draft terms of reference, and some changes have been suggested. So it's hoped that when that group next meets informally, they will be able to approve some revised terms of reference. Then the next component is the area committee. So as you'll all remember, each of the three systems will have an area committee of the North East London CCG governing body, which is the way North East London delegates powers and money down to the local systems. The North East London governing body, which and Mark can say more about this if needed, and they looked at a variety of papers at their meeting last week relating to governance, and the proposal was that the draft terms of reference for the three system area committees would be sent to those systems. The people who will be sitting in those area committees will look at them, and if they want to make any changes, they will suggest those changes, and then at the May North East London governing body, those area committee terms of reference will be approved. I think that's going to be straightforward in City and Hackney. I think it's a bit more complicated in the other two systems because they have three local authorities, and in the case of Waltham Forest, Tower Hamlets and Newham, I think there's quite a push around doing a lot at a borough level, and they maybe don't have the same history of joint working that BHR and City and Hackney have. So it might be a slightly more protracted, complicated process for them. But what all that means is that it will be the May North East London governing body that approves those area committee terms of reference. So until that's done, the area committee doesn't exist, and therefore it wouldn't be possible for us to meet as a full ICPB until that happens. So what we're suggesting is that the June meeting would be the first formal meeting of ICPB, and we would be able at that meeting as a first item of business to review and hopefully approve terms of reference for ICPB, having resolved all the issues that have been raised by the two local authorities, approve the terms of reference of the Neighbourhood Health and Care Board, and approve the terms of reference of the City and Hackney Area Committee, and then we could start working properly as an ICPB. So that would mean that, as has happened today, the May meeting would formally be an ICB meeting with other partners in attendance.
Super, great. Thanks, Jonathan. Haren.
Yes, so Jonathan, I've got a question for you. So if in June we are going to see those terms of reference and approve, would it be not possible to see them before the members can see them? Is it possible?
Sorry, how do you mean, Haren?
You know, if we are going to get in June to approve and we approve that, would it be not possible to share it before? So we have, if there are any concerns, we come back to you or anything.
Absolutely. So I just think it's prudent, given that the North East London governing body needs to approve things in May, that we don't propose looking at these formally and hopefully approving them until the June meeting. But as soon as things are in a state to be shared, then I think that's a really good idea, just to get any additional feedback that people might have.
Yes.
And a lot of people have said that they were really keen to see all of the terms of reference together, because how they fit together is as important as what is in each individual set of terms of reference. So yeah, as soon as it's ready, we'll be circulating it to the people who attend this meeting.
Thank you.
Great. Okay, so Sunil.
Thanks, Mark. Jonathan, my question was very much on the same sort of lines as Dr. Haren Patel's questions. I'd be quite keen to also be cited on all of the terms of reference well before the meeting in June for a number of reasons, including the fact that City and Hackney ICP continues to be the lead for financial governance and those related areas going forward. So it was the CCG that put together those programs of work, which were subsequently signed off by the NEL governing body. So we have a team in-house, as you know, who would look at those things as well to make sure that they all are weaved together accordingly. So I and my team would be quite keen to be cited on all of that well beforehand, before that meeting.
Yeah, there we are. Yeah, a thumbs up. Super. Chris Kennedy.
Thank you. Thanks, Jonathan. So kind of two things about sort of either end. So before all the terms of reference are approved, we're in a sort of limbo state, aren't we? Where I sort of assume that we're working under our old terms of reference in order to carry on, just to be absolutely sure that that is what we're doing and we can do that. And then also, I suppose, a note to selves that whatever terms of reference we agree, even at the NEL level, we're dependent upon what legislation is laid before Parliament and what is approved by Parliament, which probably will require further tweaking, possibly even more than tweaking, more substantial than that, depending on what Parliament agrees about ICSs. Thanks.
And so on your second point, I think everyone is conscious that this is a bit of a interim period. You know, the next year, certainly at the NEL level, they're sort of setting up their arrangements now, but they're doing it with an eye on becoming an ICS as envisaged in the white paper. But you're right, if other health legislation is anything to go by, then there could be, you know, some reasonably significant changes over the next year. My understanding, and Mark may have a view on this as from his role at North East London level, but some of the elements of North East London are bedding in. We've just talked about the area committees not being established yet. So my understanding is that we're kind of operating on a basis that is sort of safe and legal at the moment. But I don't know whether it is precisely the previous arrangements or whether there's some sort of interim arrangement in place.
From my perspective, I don't know that has actually been articulated and written down somewhere as a 3-month interim position. So yes, you come in, please.
Yeah, I was just going to say that in terms of carrying on business in the short term for Q1, you know, we have statutorily transferred over all of the contractual arrangements into the new NEL CCG. Those contracts or commitments have been signed off through various governance arrangements. Section 75 arrangement has been rolled forward. All the strategic enabler funds have been fully capitalized, for want of a better description. The SFIs and the scheme of reservation and delegation have been signed off, so we are able to conduct business in the short term while the new structure is formalized by Q1.
Great, thanks a lot. So we've got that structural kind of a wraparound security, I think. In terms of the work of this board, clearly today we've got an amended agenda because of PERDA. Then we have May, and we'll have to be mindful of any issues that we need to avoid and push on to June, because hopefully by June we'll be established formally in the way you described, Jonathan. And in the meantime, we can, as very Sunil says, continue to transact business as usual. Siobhan.
So, yes, thanks, Mark. I just wanted to add, I suppose, that other statutory duties as well are also being held at that NEL level during Q1. So there's things like safeguarding, quality assurance, etc., performance, all of those, from a NEL SMT perspective, that's very much being held there, whilst these transitionary arrangements come into place at place-based level.
Great, thanks, Siobhan. And Honor.
I'm so sorry. I put it in the chat, but it scrolled up so you missed it. Which is, we're now in a period of political sensitivity rather than PERDA. We're no longer culturally expropriating other people's words, apparently.
Ah, thank you. All right. Sorry about that, everyone.
Why would you know? I've had to know.
Well, okay, I'll hang on to that point. Thank you, Honor. But anyway, thank you for making it, for making that clear.
And Mark, one thing I was going to add is that given that we're moving to June as being the date when we would seek to approve the terms of reference, I was wondering if that creates an opportunity in May. I know there's been an offer from the lawyers who NEL are using to come to one of our meetings to answer any detailed questions people might have, and to set out some of because this is a relatively complicated arrangement with an area committee and the ICB still existing, and just being able to answer any detailed questions people might have and to talk through some scenarios of how meetings will actually run. They've done that in some of the other systems, not at formal meetings, but it just feels that if the agenda is relatively light in other ways, that might be a good use of half an hour of our time.
It certainly makes sense to me in terms of getting ahead of our discussions in June, because we would like to be able to get going as quickly as we can with the work we want to do together. So I would think that's a good idea. I'm not seeing any hands go up or any. Yeah, so Chris has said yes, please, the lawyers coming in the May meeting. So I think unless I hear anyone say no, I think we should. Yeah. I can see some nods as well. So let's work on that, Jonathan. Yeah, good idea. So I can't see any more hands. I think we should move on. So Jonathan, just to say thanks very much for that. Can I ask ICB City to note the report from Jonathan, and also Hackney ICB to note that, please? Thank you.
Noted.
Thank you very much, everyone. So moving on to update on the transitional arrangements. And Tracy and Siobhan, Tracy Fletcher, Siobhan, you've got your names next. I'm not sure who's kicking off.
We've not exactly planned the process, so I'll kick off, and then Siobhan will no doubt fill in on the detail. To some extent, the previous discussion probably covered quite a number of the themes. So from my perspective, this is the end of week one of probably having more of a, I want to say formal, but I might say a more formal approach to the system way of working, with Easter in the middle, and even within that week, it's been quite interesting, much of which revolved around the discussion we had in the Outbreak board with regards to vaccinations. So even the first sort of 3 or 4 days has been interesting in the new way of working in the new system. So I'm now trying to work much more closely with Siobhan with regards to how we develop the system, but also to support the CCG in its transition to the North East London CCG, and Siobhan will be able to talk much more about that. But my impression from the contact I've had both with Henry and at the North East London CCG meeting, which both Mark and I and Siobhan attended, is that there's still an awful lot of work in progress, which I think probably supplements what Jonathan was saying around the transition period. Despite the fact that we've known for some time this is going to happen, it sort of always does happen. And I guess on top of what is a relatively big shift, there's also been a big change in personnel as well, both with Jane Milligan going and from our perspective, David taking up his new post as well. So quite a lot to contend with. I see this piece of work and talk about it in two blocks really, albeit they are both overlapping. And one is absolutely to make sure that we land the move from City and Hackney CCG into the North East London CCG safely and nothing gets dropped, and we need to work with our North East London colleagues to make sure that that happens, but also that we don't lose sight of the place-based focus, and we do continue to provide and oversee as much as we can locally, where appropriate. And then the second block is really much more about developing the system team and the system way of working, which as you transition yourselves to an ICPB, that will encompass a wider group from the system, if we follow through on the discussions that we've talked about, and likewise with the rest of the structure throughout the system, we work across a much broader group of partners, and that notion of a real split between commissioning and providing hopefully slightly melts away, and we all become responsible for that notion of commissioning and trying to understand best how we can deliver services to our local population and try and solve some of these health inequality issues that we have as best as we can collectively and collaboratively. Practically, I think we reported at the last development session that we'd had an initial Neighbourhood Health and Care Board meeting, which really focused on trying through Sunil and his team to try and give a bit of update about where we're at with the simply with the finances and the contracts and some of the more technical work that was going on as part of the CCG changes. We need now to get regular meetings in, and it's a bit of a logistical. Yeah, there's a few logistical issues to make sure that we avoid everybody's board meetings, of which typically they are littered throughout the month and the week. So we now need to get those future meetings embedded within our diaries, and I need to make sure that the team get that done as soon as possible. And I'm intending to put out what I've always thought was the post that needed to go out first, which is the ICP. I call it the System Clinical Lead post, which Sunil and Siobhan have sorted out the technicalities associated with that. So hopefully that can be circulated this week, and we can look to begin to get the first posts that really do need to facilitate and challenge us across the system to working in that system sort of way. So I think that's a key first post to get in place. I'll ask Siobhan whether there's anything specific around the CCG work that is probably worth highlighting at this meeting as well, that you would be more aware of the detail than I would be at this stage.
Yeah, so I guess just to add to that really, Tracy, I mean, really the focus, we are putting together a kind of more detailed plan that would sit behind those slides that are in your pack, which is about standing up the new governance, local governance, the partnership governance really. So the quality and outcomes group, the people and places group, and the finance and performance group, as well as ensuring that our staff understand where they are in that system between North East London accountabilities and local system accountabilities, and being clear about how decisions get made, how they can seek support for business cases or ideas or things that they feel are important, etc. at the same time, really trying to embed the principles around the place-based working that we've all obviously been doing for quite some time, embedding patients and residents at the heart of, you know, our planning processes, our ways of working with clinical leaders, etc. So all, and our kind of really important focus on population health and health inequalities, all those things need to kind of be broadly understood by the CCG team as they transition into a local sort of supporting the partnership team. But at the same time, as Tracy says, concurrently running with the development of system working with our partners locally. And there is a major scheduling thing to happen really in terms of scheduling all these meetings and North East London meetings. So there is that flow between local meetings and North East London meetings. And yeah, there's just quite a lot of organisation for some of those processes over the next 3 months, which I think we are on top of, and we know what we need to do, and it's just making it happen really, and helping the leads locally in our system to be able to take the work forward. But yeah.
Thank you very much both, and I must say thank you from me really, you know, on behalf of the committee, you know, to see momentum continue, which is great. You know, this is challenging stuff we're setting ourselves in terms of ambition. And getting all these nuts and bolts in place to allow us to start to deliver on it is so important. And you know, thank you for keeping on going with it in the way that you are, because I think I feel very confident that we are making real progress and momentum, you know, continues. Great, thank you. Haren.
Yes, thank you, Mark. I've got a question for Siobhan. Siobhan, so City in Hackney is in unique position. There are a number of services and funding streams which are not available in other old CCG areas. So what is it during the transition? Are they going to continue? Because sometimes we are asked the question and they say we are not sure about the funding and so on. So please, can you give a clarity on that?
Which sort of services do you mean?
For example, I'll give you one which is my area of prescribing. And we have got PSPs there, which are providing service to practices on behalf of medicine management team. And one issue we're asking...
Can you just say PSPs, just for folk who might not know the acronym?
Yeah, prescribing support pharmacies for the practices. That's a service which help with our quality improvement and cost savings for the practices. So we were not sure what the funding stream for that will be for the transition period.
Okay. So the way I understand it, Haren, is that there's this 80-20 principle, and the delegation of the resources back to the local area, well, the area committee really, that is part of this group. And, you know, that there isn't necessarily, I mean, there is a drive to have a kind of universal offer, I think, across North East London, and we don't want to have disparity between our patch. You know, we want to try and offer all our residents across North East London the same services where we can. So I think there is that negotiation really between bringing other people up to standard as well, or up raising the level of investment in other areas, but not necessarily reducing the investment in those that already have it. And that's going to have to be something that's we work on. I don't think there's any risk that that's something that will just happen overnight and monies would be moved around in that sort of way. I don't believe that that's the framework at all.
I think it's important to say it isn't from the NEL perspective. It's a shame that Henry can't be on the call with us, but I don't know.
Sunil wants to, yeah.
In year 3 of the 5-year allocation that was announced 3 years ago, and Henry back as AO for she's quite clear that we continue to allocate to borough places according to those allocations, with a very small amount taken as a shared risk pool, which essentially sort of happens at the moment anyway. So Sunil, do you want to just elaborate a bit on
that? To Haren's point, as I mentioned earlier in the meeting, you know, everything has been transferred over from the outgo from City and Hackney into the new NEL organisation. So all of the business that we're undertaking last month, we're undertaking this month in terms of the allocation, the funding, the budgets. That piece of work has now been stood up in light of some of the guidance that has recently come out. We're trying to understand it, digest it, and therefore apply it. And we're standing up a team that covers the 3 ICPs and NEL to actually pull together a plan, a suite of budgets that are devolved down to the ICP. So that's all work in progress. But when it comes to some of the specific points you raised, Harren, I'm quite happy to meet with you after this call at some point in time and talk those through. But certainly it's still business as usual at this point in time. You know, and I completely concur with Siobhan's point on disparity and sort of realigning or bringing up, you know, a level of service provision across the entire North East London geography, and that is one of the key aims of the new organisation going forward. So it probably doesn't answer your question, but those services that you talk about, I suspect, are still continuing.
Yeah, so no, I do understand Siobhan's and Sunil, your point that we have to bring them up to the level of service what we have in City Hackney. But meanwhile, we cannot stop those services while it's happening. We are up skilling the other areas. So that's what the point is.
And I completely understand that. It would be somewhat sort of, it wouldn't be right to switch off investment that has delivered such a good outcome financially and or other quality wise within the system, and that's something I wouldn't, I would not support. You know, we do need to maintain those services that are providing excellent outcomes.
Thank you.
Thank you, Sunil. John, and I just add that it's the levelling up mantra, which we, as well as the 80-20 principle, and these are principles that were 31 of them were eventually written and endorsed by the chairs and presented when the CCGs merged, and they continue to be things we test ourselves against, and I'm certainly very keen that we do so at the NEL level. So John Williams. John, are you with us? Not quite. Jake, do you want to come in whilst John sorts out his IT?
Thanks, Mark, and thanks, Tracy and Siobhan. I mean, I can only sympathise with work. Must be on top of your day jobs. So I'm surprised you're still smiling, but it's great to see that you're on top of things. As many partners in this call will know, there was sign off of the VCSE enabler work several months ago, which is all about supporting the voluntary sector to develop strategic responses to the big issues that we face, mental health and so on. And I think mental health is likely to be our first assembly conversation that we'll have in June. So we're planning an assembly in June, bringing hundreds of organisations together. I suppose what's not clear to me at this minute is how business cases from any part of the system, actually, not just the voluntary sector, but how business cases will come into the system and then be addressed by this board, other boards. So it'd be good to get a sense of how you see that flow happening. And then also a sort of broader question about ensuring that sort of the voluntary sector, given that we're all working in sort of a big team these days, that's how it feels to us anyway, how we can ensure we've got representation across all the different parts of the system, because, you know, we can bring certain expertise, and particularly of focus on inequalities, we can bring some more insight to all the discussions that are happening. Sorry, two big questions there, and I don't expect you'll have clear answers, but if you could give us a steer, that'd be really helpful.
Mark, can I just come in on that immediately? Partly because, Jake, the first question you asked is a question I've asked. So I don't think we do necessarily, well, I don't have an answer to that yet. And Sunil and I have had a couple of conversations about it. And I think we've got to get our thought processes clear, because there are, that's largely been precipitated by a couple of emails that have been floating around ideas and propositions and cases that are in the ether. And one of the things I think we need to be absolutely clear about is we're taking quite an open and transparent approach to this, that there is a open and equal access to those wishing to raise areas in which they think there's an opportunity for doing something differently, and making sure that we're taking a pretty open approach to prioritising that as well, or at least having a means to be able to describe that and describe the choices that we're making as a system, both at this board but also throughout the system as well. So I think that's something that we probably need to do a little bit of thinking about, given that development of that system work. But I'm equally very conscious that, and I know Sunil is as well, that time is going to be of the essence, because people are going to want to get on and do things, and also there's going to be pressure coming through. I mean, we've already, the past few days, I feel like I've spent all my time talking about vaccines and the pressures coming through on what we're going to do over the next year for that. So there's going to be different draws on what we've got as resources as well, I think, coming through the system. But yeah, that first question you've asked is a very relevant one, and one that I couldn't answer at this moment in time, but I've been asking as well. I think the only thing that I'd probably add to that is your first point. Yeah, I think we're all still smiling, and it's quite exciting and interesting. But it's still quite a lot. There's quite a lot of work to do as well in making that transition and supporting staff through it and not dropping anything, which I think we need to collectively as a sort of senior team need to make sure that we don't do that, because there's an awful lot of people who are still working within the CCG who need that support.
Can I just add as well that I guess the other thing is that when we start thinking about our programs of work as well, Jake, so we are starting to think about, the new programs that have been identified for rehabilitation, independence, neighbourhoods, communities, mental health, etc., children and young people. It is really, I think that's really where all the action needs to be, because that's where we want to have that active participation from the wider system partners in shaping what are the things that we need to do. And I think that's, it's not so much just about the structures, that these types of structures, but it's also where the delivery happens. So that's another place where we will be really keen to make sure that we've got everybody properly represented.
Great, thank you. And I see 2 thumbs up from Jake. So, well, one at a time. But anyway, so hopefully that was reassuring up to a point. Sunil, did you want to come in on this particular point before I turn to John, who's now connected?
Yeah, I think between Tracy and Siobhan, they've covered off sort of 99% of it. But just to sort of remind everyone that even though we've moved from City and Hackney CCG to City Hackney ICB, we will still be in some respects constrained by the budget we will be operating within, as opposed to the resource allocation, which will be held at the centre. So we need to be mindful that, whilst we have an operating model and we'll run those business case considerations through the operating model that we stand up, there will be financial considerations and constraints, just as they were within City and Hackney CCG in terms of considering those business cases. So they would have to show a return of some kind, and I'm not just talking about financial, but or other quality outcomes, etc. So those things we still need to be mindful of. And as I've said a few minutes ago, we're now standing up the infrastructure and the working arrangements to start the planning process around creating those budgets for the ICPs off the back of guidance that was recently issued. So yeah, there'll be more updates on that to come in the future.
Okay, thank you, Sunil. So, John, hopefully you remain connected. John Williams?
Yeah, well, if you can hopefully hear me now, Mark.
We can.
Good, excellent. All right. Well, firstly, Tracy and Siobhan, thank you very much for this report. It's really helpful to see. Just on the place-based principles for planning, which I understand as I think you said, Siobhan, that these are high level and there'll be a more detailed report coming on these. I'm kind of curious why co-production isn't mentioned as the public involvement, because I think that's one of the key things that we've been very good at trying to develop in the city in Hackney, we want to take across northeast London as well, and there's an ambition to have a co-production charter across the northeast London area. So I would like to see that really as one of the kind of high-level principles here. And just to be reassured that the number 8, the consider the elements of sustainability, isn't a pick and choose approach, because sustainability should be a kind of a key watchword for us all now as we go forward. Thanks.
Yeah, I mean, very much so, John. I would totally agree with that. The co-production piece, I think probably you might see that more reflected in the people in place part of the document. But yes, I totally take your point. And similarly with sustainability, we have actually a meeting in the diary on Monday to talk about that in a bit more depth about how we take that forward, and that's involving Anne and Jonathan as well. So yeah.
Great.
Okay, thank you. Chris Kennedy.
Thank you. Look, really positive to hear that Sunil and Tracy are having those difficult conversations, those tricky, more detailed conversations, and really great to hear Siobhan saying that that sector at the neighbourhood level that we're working with is going to help provide those neighbourhood level interventions that we know will be best for our populations, that they'll be properly represented. I just want to stitch that proper representation into those conversations that Sunil and Tracy are having and say we need some sustainable, proper resourcing as well as proper representation. So I think it's about how we at our level manage to make sure that we have long-term planned resources that help those interventions at the neighbourhood level. And quite right, someone's mentioned it already, we need to measure the results of what those resources provide, and we need to, quality assure them and make sure that, if the £10 that we spend locally is saving £100, we keep spending £10 locally, or probably we spend more of it locally. But if it's not saving anything further upstream, we change it and we look at it and we measure those interventions. But I would remind everyone of David's idea for the prevention investment stream, which was that a small percentage of sort of all the budgets of everyone involved was sort of top sliced and went into pins, something like that, that permanently talks about resourcing right down at that level, those community organisations that have those first interventions in people's lives, I think is what we really want to be aiming for. Thank you.
Thank you, Chris, and thank you. I think that's a really helpful reminder about the PINS ambition. I've got Rob Chapman's hand up next. Rob, I do apologise. Can you just remind me of?
Hi, I'm Councillor Rob Chapman. I'm the Cabinet Member for Finance at Hackney. And
Rob, I can now recognise your face now. Sorry. It's
all right. Yeah, I was going to raise a very similar point to Chris, really. Just a bit more sort of mundane. Have we, forgive me if this has been covered because before I joined the board, but have we seen a sort of detailed budget for this all going forward? I mean, we have plans, so I'm assuming that attached to those plans there's a resourcing plan, which is the budget, and it'd be quite good to understand that in some detail if it's available.
Mark, shall I take that?
Yes, okay, so sorry, yeah. I was just
so perhaps I should have introduced that by just saying, hello everyone, I'm very pleased to be here. Thank you.
Well, you're very welcome. So yeah, so back to you.
Thanks, Mark. Hi, Rob. Good to meet you. So, Rob, as I said a few minutes ago, we've had the beginnings of some finance guidance, notification of additional funding that's coming through the NHS. For the first 6 months, additional funding around an elective recovery and restart. So the NEL CCG and the 3 ICPs are coming together to start the planning process of pulling together those budgets. So they are only now being we're now only now beginning to consider what those budgets might look like, and we have an infrastructure that we've set up that we're going to operate within to actually stand those budgets up. So as I said earlier on, regular updates will be given to members and attendees of this meeting, and updates will be presented in other forums. And likewise, we'll also work with Ian and the wider team at LBH and City of London to actually understand the budgets from your side as well and bring them all together. So all currently work in progress, and yes, we are delayed in our timing around this because of COVID, because of the merger, and because of other factors coming into play. But we're very mindful that this piece of work needs to be delivered ASAP, and there are established relationships and task and finish groups within the ICP, working with LBH and City of London colleagues and the wider colleagues and partners to actually pull all this together.
Thank you, Sunil. Rob, do you want to come back?
Yeah, thank you. That's helpful. Obviously we're now into the 21-22 financial year, and we are doing things and are spending money. I mean, is the plan to bring something with the budget in its totality back here shortly, so we can see it all? Because to my mind, it's an important part of the plan. You know, a plan isn't really a plan until you've attached the resources to it.
Yeah. An update on the budgets will be brought back to this meeting on a very regular basis, and I'll actually meet with Alex and the team to actually formalize that onto the agenda. As I said, we're only now just beginning to consider what those budgets might look like. So there's a lot of planning. There's multi-million pounds worth of contracts that were novated over into the new organisation, and we just need to understand what that looks like and set budget. So it is work in progress. The updates will be brought back, and ultimately the NEL CCG will sign off the healthcare budgets for the system as well. So all of that needs to happen in a coordinated manner, but updates will be brought back to this committee in due course.
But we should say, really, shouldn't we, Sunil, that that shouldn't sort of be very much different to what our previous City and Hackney budget was, the CCG budget.
That's right. I think
the framework is that we're taking on board that 80-20 principle, and how the reserves have been handled, etc. That, you know, with that the allocation coming back to the local system.
Yeah. So
budget setting is an exercise we do every year, you know, so it wouldn't necessarily deviate hugely from that overall pot.
No, that's correct, Siobhan. Essentially, City and Hackney had around £530 million of business to conduct in terms of funding that it received from the centre. That funding, in the main, has been rolled forward. The risk reserve around that and the contingencies, which is part of our business planning process, those sums of money or those allocations will be held at the centre to ensure that we cover those potential cost pressures and risks on a year-to-go basis. So essentially, we've got to formalise the budgets, we've got to formalise the operating plan in line with the guidance that has been issued recently. But as I said a few moments ago, we will bring back very regular updates to this committee meeting, and no doubt also internally within the CCG and to the FPC and the governing body, etc., going forward.
Brilliant, thank you, Sunil. John, I'm assuming that's a legacy hand, and I'll bring Tracy back.
Just to add to that conversation, and forgive me because this is my first meeting, so I probably should actually wait until I can talk to Sunil and Siobhan about it, but then I thought, well, I'll mention it anyway. So presumably some of that finance position also ought to include the wider system as well. So those elements of social care and public health that play into the overall position, and it would be wrong of us just to talk about the health side generally, and we do need to start seeing how that comes in the round. I think that's what this meeting is about, but no doubt Sunil or Siobhan will give me a good kicking later if I've got that wrong.
Tracy, you're quite right in the way you describe the situation. So the integrated finance report, which I think is the next agenda item, shows the City and Hackney ICP budget position, but also the LBH for the portfolio of business that it conducts through the ICPB fora, and also the City of London. So the budget setting process will be inclusive of LBH COL going forward. and those budgets will include all of the commitments we make across the City and Hackney ICB system with all of our other providers as well, voluntary sector and or other. So it will be a consolidated process involving all of our partners.
Excellent. Well, that sounds very good indeed. That was the last hand up. I haven't seen anything else about that. So maybe I should say thank you very much to Tracy and Siobhan for the update. Can I ask City ICB to note the update, please? And Hackney ICB similarly to note it, please.
Noted.
Thank you very much.
No, noted.
So I hope you've had a moment to draw breath, have a sip of water before we turn to you again for the finance update, because you've got your name on it.
Thank you, Mark. I'm not too sure that Ian Williams is on the call.
I didn't see him actually, so I think, yeah.
So I'm going to sort of have to rely on colleagues to have sort of read the LBH part of the paper, but I'll start off by giving an update on the City Hackney piece. The situation is very much as I presented before. City and Hackney for 2020-21, the year just gone, will be declaring a break-even position in terms of its overall spend for the year, in line with its statutory requirements delivery. The break-even position, as everyone knows, was previously declared as a deficit. What we reined that back in through a number of recurrent and/or non-recurrent measures, and that is our trajectory for the year end. So the finance teams and the colleagues within the City and Hackney ICP are working to bring the year end in, and we'll be working with external audit. In terms of the value for money audit, that's been given the all clear from external audit. The Mental Health Investment Standard Programme has been signed off by external audit for the last financial year, and we hope to be able to deliver our mental health investment standard spend for this year. So no concerns there. From a system perspective, all 7 CCGs in North East London are aiming to declare a break-even position. As you know, I'm in charge of the financial accounting and the year-end close for the well CCGs, and that is the position there as well. So from a system perspective, break-even for all CCGs, and from a wider system perspective, including all of our provider organisations, we will hit our control total of break-even or thereabouts for 2021. So quite a challenging year. I'm very pleased to report that is our delivery programme that we hope to hold to for the end of this year. In terms of planning, we have received guidance for the first 6 months of the financial year. There is funding which is coming down. The NHS has received an extra £6.6 billion of additional funding, plus funding for COVID and additional funding for elective recovery and mental health work and workforce development programs. So all of that needs to be broken down and considered and pulled together as part of an operating plan and some of the budgets that we need to pull together in the coming weeks. So, and further updates will be given on that. So I'll take a pause there for the City and Hackney piece. Well, in fact, I'll answer questions at the very end. So that's the City and Hackney situation. In terms of
Sunil, just to say that Rob's put in the chat that it will be joining us at 11, which is kind of now. So maybe do you want to take a couple of questions now? And see if
I'm happy to take questions on the City and Hackney CCG closing position.
Cool. Otherwise, we'll turn to you again for the next bit. So Helen Fentiman, you put your hand up.
Yes, thank you very much. And congratulations, Donald, because I know how hard it is to reach a break even at the end of the year, especially when it's been tricky through the year. And you've had to work very hard at that, I'm sure. So congratulations.
Thank you.
I am interested in the month 11 showed 1.4 underspend, and you're anticipating break even at the year end.
Go on mute. Sunil, you're not on mute. Maybe it's coming from your end. It's coming from my end. I don't know. Anyway, Helen, carry on.
Okay, sorry. So yeah, just to repeat that final statement, you're anticipating break even at the year end. I was just wondering if the 1.4 underspend declared at month 11, whether that that had just been applied to the normal sort of services during the month end to reach the break-even position, or whether it's been used for broader NEL support.
I'm really sorry, Helen. I can't hear you. There's a lot of distortion on the line, and I don't know if someone else has not muted. But I think what you're saying is, in response to your question, as at month 11, we're also declaring a break-even position, and we're looking to hold that position for month 12. And to date, there is nothing which indicates that we will move away from a break-even position that was declared for month 11.
Okay, I don't know. Is it any better now?
There is a very strong echo. I can barely hear you. I'm really sorry.
Don't worry. I'll use the chat box.
Okay.
I forgot that I muted myself as well. So anyway, yes. So if we'll keep an eye out for Helen's comment in the chat. So, but I think Ian, have you joined us?
Yes. Good morning.
Great. I assume it's that Ian because it just says Ian, which. but since Anne Ian had just joined us, I assumed it was you, Ian. Do you want to pick up the report from the Hackney position?
Yes, certainly. So, position in relation to month 11 from Hackney's perspective is very similar to what I reported last month, to be honest. We're still forecasting an overspend of just under £7 million, of which the majority of it relates to COVID expenditure, and that's across both pooled and aligned budgets. Obviously, the COVID-related expenditure has had significant implications for the borough, but what we're looking to do overall, and bringing this together in the council's overall financial position report, which Councillor Chapman and I take to Cabinet each month, is a position of a modest overall council-wide overspend of just over £2 million. And obviously we're looking to bring that in as we close the accounts for financial year 2020-21. Our attention now really is focused on delivering the budget for 21-22, and I'll bring an update on the budget for 21-22 to a future one of these meetings, particularly drawing members' attention to the continuation of some of the sales fees and charges scheme that the government are now going to continue into the first quarter of this financial year. We are in April now, aren't we? And also just setting out how we're making progress against making sure all the savings that were agreed as part of the 21-22 budget are being delivered as well. Obviously, the council, as you're all aware, is also grappling with the implications of the criminal cyber attack, which we were subjected to back in October. And obviously, that does of itself bring challenges to us in terms of having to bring forward expenditure, particularly in replacement of some of the legacy systems that it isn't worth us bringing back into play. So I'll pause there. Happy to take any questions.
Thank you, Ian. Whilst people consider that questions and stuff, I'll just read out Helen's question she put in the chat for you, Sonal. I'm interested in month 11 underspend and how that has been applied to reach year-end break-even. Have you been able to support anything new, or has it been applied to services needing support or used to support across the NEL system? Do you want to come back on that question?
Sure. In terms of the underspend, we have mitigated that underspend as a result of some year-end or in-year underspends against budgets that weren't utilised, despite the COVID situation. There were some long-standing disputes which were subsequently concluded, which had some non-recurrent benefits, but recurrent benefits going forward. And we also contributed to COVID and or other service arrangements as well during the financial year. So a combination of all three. We also kept a very clear track of all of those underspends, all of those sort of areas that we did not spend on, and all of those areas that we did spend on as a result of concluding disputes. So everything was recycled or reinvested or repurposed to deliver the underspend and also to deliver the services in year for City and Hackney CCG. Essentially, I can't recall any sort of funding going across the NEL system from City and Hackney. So I don't know whether that answers your question, Helen, but I can actually send you a full analysis of how we came to a break-even position from a £7.6 million deficit.
Sonal, thank you. Did we have any? I mean, obviously there's a statement about the city in the pack. I don't know if anyone wanted to highlight anything from that. Otherwise, I can't see any other questions.
Helen's got a hand up.
Helen again, or is that? Oh yes, I have my cursor on top. Helen, did you want to come back in, or try again with the?
No, I'll use chat box.
Okay. Well, we heard you very clearly then. Actually.
Yeah.
The mushy sound had disappeared.
Okay, well, it was simply to say thank you, Sunil. That was very helpful. And yes, it would be good to see the analysis. Thank you very much.
That's fine. I'll arrange for that to be sent over.
Thanks.
Good. Okay. All right. Well, I think if there aren't any more comments for anyone, obviously we'll look forward to see how this reportage develops in line with all our changes to the way we work as we move into the ICP ways of working, which we've already rehearsed today. So for now, thank you very much. Can I ask City to note the report?
Noted.
Thank you very much. And Hackney ICB to note report.
Noted.
Noted.
Thank you very much. So we've got the workstream programme risk registers for noting. And Matt, I don't know if Matt's on the call. Matt, are you with us yet?
Hi, Mark. Yes, I am.
Matt, hello. Great. Do you want to give us a few highlights? Obviously, it's a bridged report this time.
Yes, so we're receiving red rated risks only this time around. This is the end of Q4 2021 risk register position. The summary starts on page 37 of the circulated papers. We've got 8 red rated risks in total, and there are no changes in scores on a month-to-month basis. The 2 risks that do indicate rises relating to quarter-to-quarter movements. Obviously, next month we'll start looking at risks for the new financial year. Happy to take any questions or feedback. I can take back to the work streams for kind of detailed responses if it's a detailed question.
Okay, Honor.
Thank you very much. It was just to say thank you very much for the circulation of the additional information around the children, young people, maternity and families risk 19, which was about the increasing use of CAM services, well, representing the huge amounts of mental health problems our young people are facing. I am particularly concerned, as I think I talked about last time, about children who are living with a variety of disadvantages. And I just wondered if we could have a little more detail, perhaps. It's not urgent, but I'd like us to hold on to the idea that lots of children, you know, for example, the children who have a diagnosis of autistic spectrum conditions and disabilities, and also have mental health problems, are having such a very difficult time, particularly as they may be in families who are shielding for other reasons. I am just very concerned about a cohort of children who are less visible, who won't be using any of the self-help and digital offers, and yeah, and they remain in my mind, this group, because I think we should need to be very, very concerned about them and their families. Thank you.
Thanks, Hannah. I'm not sure, yeah, if anyone wants to respond to that, or we'll just hear it. Thank you. Any further comments, Chris?
Thank you. I just wanted, because it absolutely builds on what we were talking about earlier, to draw everyone's attention to UC 20, which of the 2 that are pulled out in that first little highlight is the second one. So I can't see a page number. Yes, I can. It's on page 39. And that absolutely underlines the importance, I think, of what we were talking about earlier in terms of identifying that resource that at that neighbourhood level is going to help us with our health inequalities and helping our partners, especially in our primary care networks and our 8 neighbourhoods, on tackling health inequalities. And I wonder if someone knows, because I'm afraid I don't, and I probably should do, any more about the Direct Enhanced Service, DES, that was meant to be coming out this month and has now been delayed, because it looks like that will be crucial to that work that we want to happen at our neighbourhood level on health inequalities. Thank you.
I don't know if, well, Haren or Jenny, do you want to, as PCN kind of CDs, do you want to give your perspective on that, the Health Inequality Direct Enhanced Service? Maybe you don't. Maybe there isn't more to say until we hear more guidance. That's fine. Have a think. In the meantime, I'll bring in Siobhan.
Thanks. I wasn't going to pick up about the DES necessarily, but I was just going to respond to Chris's comments around, well, and I think it sort of links back to what he was saying about the prevention investment standard. And just to give reassurance, really, I think, because and maybe didn't come across in the earlier presentation about the work around health inequalities, the population hub, and the need to drive towards investment in prevention. And that's very much going to be core and central in our planning model for place-based working, for sure. So that we haven't lost sight of that prevention investment standard, etc. So I just wanted to give reassurance around that, really. And I think that if that has been delayed, that part of the DES for PCNs, I don't know the detail of that, but I'm sure we can find out when it's due to come online.
I don't know. Thanks, Siobhan. I think probably people aren't shipping because it isn't known yet, so we just need to find out when it gets announced, etc. And let people know. And, yeah. Jenny Duckworth, our other PCN-CD rep, come in, please.
So yes, just on the point about the health inequalities, it has been delayed, but there is some work in progress in looking at how we address kind of health inequalities within each of the networks. So, I mean, what we could do is that when we've got an update, we could actually bring it back to this meeting and let people know what the plans would be. But there's lots of other works going on, you know, with Sandra and the steering group. So hoping to kind of bring that all into looking at this kind of health inequalities.
Yeah, bringing it into the whole, indeed. Yeah, sure, absolutely. Thanks, Jenny. Have we got any other further? Jenny, I think your hand is up. There's a bit of chat in the chat, but no more hands. Great. Okay, so thank you very much, everybody. So I guess we're moving on to just, well, can we just ask City ICB to note the report, please? And Hackney colleagues, ICB colleagues, to note it, please. Thank you very much.
Noted, thank you.
Noted, thank you.
Thank you. Thanks very much, everyone. So we've got one item for information, just the summary of the City and Hackney ICP development session. We have got a moment or two if anybody wanted to pick up anything from that. No, okay. Otherwise, we should move on. Have we got any AOBs? I haven't been notified any in advance, but Sunil, do you have something for us?
Just to revisit the prevention investment standard item that was brought up across the various agenda items today. I'm keen that we've created a strategic enabler. It's being capitalized. It's underpinned by non-recurrent investments. So I suppose that should be on our agenda item in coming months to actually revisit, I think, in terms of some of the early progress that's been made, because there was a lot of work done in the previous financial year. It was then paused because of the COVID situation. It's now been rebooted, but that's something maybe we should focus on as an initiative going forward. not just for this financial year, but into the next financial year as well, when we become an ICS, maybe not to lose the momentum on that, but something which is of great interest to everyone. So we should sort of have it on the agenda coming as soon as it becomes available in terms of an update.
Yeah, sure. And I think it's very interesting to think about how we manage our forward plan in terms of work coming forward and reports from the different kind of transformation groups, etc. Good. Okay. Thanks for that, Sar. I haven't seen any more AOBs, so I guess we should just pause for a moment before we finish, as we normally do, just for sharing your reflections about how we've got on today. Does anybody want to share some thoughts? Well, I'll start quickly. I mean, I do feel rather excited about the whole thing, actually. I know we're in a position of transformation, but I do think we're you know, I was serious about the momentum and actually seeing things moving on. And there has been lots of change, literally in the last, you know, notwithstanding a pandemic, but also, you know, with the CCG changing and various other things happening. But actually we are continuing on our course, which is really encouraging. And I think, you know, there's lots of great work happening, and various thanks to Sunil and finance colleagues, remarkable kind of work bringing in the numbers in the way you described, you know, Tracy Siobhan, the piece we're talking about, the ICB and developing all of that, and Jonathan's role in all, but we could share it all. I think I feel there's a real kind of pulling together, which I just think is great, and I do feel rather excited about it all. So that's something from me, and in the meantime, people have had a moment to think. So Rob, I'll bring you in, and then I'll bring in Anna.
Thank you, Mark. Can I just say, as a relative newbie, it's I think great to sit in a room full of. I know, you know, there'll be minor differences between all the organisations involved here, but it's great to sit in a room of a virtual room of dedicated, committed people. And I, like you, I have a feeling that there's a positivity about making whatever changes come in front of us as a success for the people of East London. It's great being here. Thank you.
Thanks, Rob. Anna.
Thank you very much. Well, I've spent the meeting chastising myself for so rudely telling Mark that we shouldn't use the word further, and that wasn't kind. And given that kindness is our watchword, I should have thought of a better way to say. I wonder if so I apologise. But I suppose what I like about this meeting in this, you know, transition form is that we are getting so much better at talking about the shared and collective responsibility. I know that we all have our statutory duties that we will perform, but the idea that we can enable others to do better and they can help us seems to be really important. That notion that we're talking about a healthcare, neighbourhood, voluntary sector system seems to me to be really emerging. It's something we really need to hold on to. And I was so pleased that we have people like Jenny here, because I do think that local clinical leadership is going to make such a difference on the ground. So I was really, really delighted. It felt really, really positive. Thank you.
No, thanks, Anna. Yeah, absolutely. Well said. I mean, and yeah, well, I agree with everything you said, but the unkindness was, I didn't feel it. So I agree with everything you said except that bit, but I know what you mean, so it's appreciated. Thank you. So Tracy, you've got your hand up.
Thanks, Mark. So it's been an interesting meeting, so I've enjoyed my first one. So I'm saying this because I'm going to consistently try and challenge myself to make sure that I am, in the context of these meetings, adopting a system approach, and the system approach is you know, fairly widely encompassing. So I'm saying this genuinely from that perspective, as opposed to from the perspective of the organisation who pays my wages. What's interesting about this meeting is there's been a shift in some area, but not in others, and there's nobody from the Mental Health Trust, and there's nobody from the Acute and Community Trust involved. And if we're making that transition, then we may need to think about that now. And had it been that there weren't PCN representatives, I've been making the same point about them. If the Homerton or Elft were here. So it is genuinely said from that point of view. So I think we probably need to think about that in terms of if we are thinking about system way of working, what partners aren't involved. Sorry, that's my phone.
Okay, thank you, Tracy. So yes, indeed, we need to keep mindful to make sure we're doing the things that we want to do and get the right representation as part of that. I'm just seeing if there's any other hands up just before I ought to finish off. That telephone would suggest we do need to stop fairly quickly and get back to other things. But Sandra, you have your hand up, so maybe the last word to you.
Yeah, thanks. I didn't know if you could actually see my virtual hand that time. So just a couple of things from me, and actually agreeing with Tracy's point really about making sure that we really are reflecting the whole system in representation, but not just in representation, but in terms of the way that we think and how the discussions that we have and how we're thinking about what we're trying to do. And this isn't just about healthcare, it's not just about health and social care, although it's largely about that, but it's actually about improving up our population's health, and some of that will be about the services that we deliver, obviously, but some of it won't be. And so there's a broader discussion that we need to have. But actually just to think about how we work together in the meeting, and so Honor's intervention earlier actually made me think, because I've been thinking and reflecting a lot on in inclusion and exclusion and cultural appropriation and things like that for quite some time now, because I've been leading a piece of work on racism as a public health issue for the Association of Directors of Public Health in London, but also in the last week or so because of the Sewell report being published. And when Honor started chastising herself about, first of all said we shouldn't use that word, and then started chastising herself, I started thinking about where is the line between what's cultural appropriation and what isn't, and how many words that aren't of English origin have been incorporated into English, but also how many other cultures incorporate English words into their language. And and is it about the power dynamic, and to start reflecting on that, and perhaps we need to, and so yes, Honor, be kind to yourself, and as well as being as we need to be kind to each other, but also I think that we need to take a moment, take a beat when those things happen before we immediately leap to something like that must be cultural appropriation. So that was just one thing that I was reflecting on. And then the other one was picking up on Robert's point about how we all seem to be in agreement, and I think that's good, and it's it is good, but actually at the same time it's when there's a bit of friction that you get the creativity, isn't it? And so it's nice that we all get on, but I think we sometimes need to get a bit past the fact that we all really get on with each other and surface the areas where we don't quite agree, where our agendas, our different organizational agendas don't align, because that's where we can just be then creative about how we solve the problems that can cause, and therefore achieve something better for our community.
Sandra, thank you. As ever, that was well said. And thank you. So last word to you, and that was a very fine ending point. So with that, I should say thanks everyone. Thanks for your time. Thanks for all your effort and work. And yeah, we're ending just a couple of minutes early. So there we go. So see you all soon. Take care. Bye.
Bye.
Bye.